Okay, so we're going to be right in here. All right, this is Mr. Sam Johnson.
Hi, Mr. Sam. How are you doing today?
Good.
Good. You can go and have a seat for me. Okay, Mr. Johnson. So you're 65, correct?
Mm-hmm.
Okay, great. And you have been diagnosed with Parkinson's disease? Okay, gotcha. I see that you're also under the treatment of a physician, correct? We love that. And your current medications are levodopa. Is there anything that you can tell me on that, or?
No, I just take it for obviously the disease.
Okay, I gotcha. So what I would like to tell you and kind of the dental considerations that we have when you're here are that it's linked to oropharyngeal pain. And that's basically some throat pain. It also leads to orthostatic hypotension. So I'm just gonna make sure that you feel okay after I lift you up from the chair. And we'll just take a few minutes before you actually get out of the chair so that nothing happens or you don't fall or anything, okay? And it also causes some xerostomia, which is dry mouth. Do you feel some dry mouth sometimes? Okay, gotcha. But yes, I just wanted to inform you what that medication does to you, okay? From there, do you need a pre-med? Have you taken a pre-med, or do you need one? Okay, perfect. And you don't have any allergies, correct? Okay. And you're not using any tobacco use, any ends?
No tobacco since 1985.
There you go. We love to see it. Awesome. And then no removable appliances or fever blisters, right?
No.
You're okay? Perfect. Well, I took all of your vitals already. Your blood pressure was 130/80, which was a little high at first, but then we retook it, and now you're within normal limits. So you should be perfectly fine from there. What we're gonna do, we're gonna go on to perio charting and some dental charting, and we'll just continue treatment, okay?
Thank you.
Okay, Mr. Johnson. So right behind me is your caregiver, correct? Okay, great. Nice to meet you. So what we're going to do is talk about periodontal disease. So what I have seen is that you have past gingivitis. Gingivitis is inflammation of the gums, and that's reversible. But what I've seen is that you have kind of progressed into periodontal disease. Periodontal disease is the disease of the oral cavity, and that results into some bone loss. It can result into teeth mobility, which kind of means like looser, wiggly teeth, and we just don't want that to progress. Again, like I said, you're kind of in those first early stages of periodontal disease, but it's not too bad that we can't maintain it together. So I'm going to show you a couple of things that you can do so that we can kind of diminish the periodontal, or just kind of recess the periodontal disease so it doesn't progress afterwards, okay? So when you're at home, do you use a manual or a electric toothbrush?
Manual.
A manual toothbrush? Okay. Could you show me how you brush your teeth at home? Could you do that? And if you could, I'll lift up the mirror for you, okay? Okay, I gotcha. Okay. Is that a little difficult for you using that manual toothbrush? Okay, I gotcha. So what I'm gonna do is just kind of show you, if you can hold right here, how to brush with that manual toothbrush. What you're gonna do is you're gonna go in at a 45-degree angle. If you could see that as well. Perfect, awesome. And you're just gonna touch all the sides and surfaces of your teeth. So you'll go in like that. But I do have some other modifications that we can do instead of a manual toothbrush, so it's a little bit easier for you, okay? So when you're at home, do you also floss? No? Okay, that's okay. And I'll kind of teach you about that here in a moment too, okay? And do you use any mouthwash? You do use mouthwash? Do you know if it has alcohol in it or if it's alcohol free?
I think it has alcohol in it.
Okay, I gotcha. So something that we might need to switch out is that mouthwash. Like I said kind of in the beginning, he's taken levodopa, which leads to xerostomia. That's a dry mouth. He told me that he had a little bit of dry mouth. And we want to go ahead and switch that to something that's non-alcoholic. That alcohol really just dries the mouth out, and if it's non-alcoholic, it'll really help with that dry mouth. It'll help the pH levels there. But here in a moment, let's go ahead and get into some other modifications that we can do, okay? Okay, Mr. Johnson, so I'm going to kind of explain to you how to use an electric toothbrush because I think that it will help you with your dexterity and such. And caregiver, if you want to come down this way, just to kind of watch and see what you two might be able to collaborate and do at home.
Okay.
And so we're just going to pretend that this is an electric toothbrush. A lot of them come with instructions, so if you both could just kind of read those together and see what those instructions are. Each toothbrush is a little bit different, but a lot of them just require you. So what you'll do, Mr. Johnson, is hold this, or in your other hand, you can switch. Perfect. And I'll hold this for you. And go ahead, and if you could just place your toothbrush just right on your teeth. And you're just going to hold it there. The electric toothbrush is going to kind of do the work for you, so he doesn't have to really press down any. And after that, he should be good to go. And I can take this from you. Thank you. And afterwards as well, you're just going to brush the tongue from the top all the way down. Could you show that to me? Okay, go ahead. And with an electric toothbrush, you'll just turn it off and do so. Just stick your tongue out. Perfect. Awesome. And caregiver, if you're just kind of looking, he's kind of doing that.
Okay.
Great. You're doing great, Mr. Johnson. Awesome. But again, you two can kind of just collaborate and see what works best for Mr. Johnson. And yeah, that'll be great. And I'll go ahead and get into some interdental floss cleaner for him too.
Okay.
Okay, so here I've got a couple of things. You told me that you didn't floss at home. So I've got some things that will make it a lot easier for you to floss at home. So this little bad boy is a interdental floss cleaner. This is going to be kind of where you stick it in between your teeth, and you'll kind of go in and out, and it'll clean in between those teeth. And again, with your dexterity issues, it will help. So here's this. And then I've also got one that's a little bit longer, so that you're not having to use this small thing to go all the way to those back molars. So again, you'll just be able to use that in the mirror and do that. So if you could kind of show me how you probably go in there. Perfect. And then if you want to go a little bit backward, see how easier that is for you. Perfect. You're doing great, Mr. Johnson. I'm going to take that from you, and I could send both of you home with some of these as well, okay?
Perfect.
Awesome. And what we'll also do is we'll get you in a little bit quicker, maybe every 4 months or so. And now we can just go ahead and just talk about your treatment plan. Okay, Mr. Johnson, I'm just going to explain to you what your treatment plan is going to consist of for the next couple of weeks, okay? So this next week, what we want to do is kind of deep clean your top arch, that maxillary arch. We're kind of splitting the cleaning into 2 sessions, just so that due to like your medications that you're taking, you're not lowered in your chair for so long. And if there's any sensitivity or anything like that, it won't affect you to that, okay? So we're just going to clean the top teeth for you. And then after that, you're going to come in the next week, and we're going to clean the lower arch for you, so that mandibular arch. Again, we just don't want you in the chair for too long, and it might just help with any kind of sensitivity issues. From there, what we're going to do is we want you to come back a week after that, just so that we can reevaluate and see how your gums are looking and how everything looks after you kind of used your treatment modifications, like your electric toothbrush and those interdental care items that I showed you. And then from there, after that, we're going to get you on a 4-month recall. So we want to see you every 4 months, just to make sure that you're doing well with your oral hygiene at home and everything is looking okay. Okay? Do you have any questions, or is there anything that I can explain to y'all?
No, thank you.
Yeah, absolutely. Thank y'all so much for coming in.